Okay, so it's Gary,
Correct.
Garrett, yes. So, we talked in the past, and some of your, we talked a lot about the clinical value of, there's obviously operational value and some ROI.
Mm-hmm.
I heard you talking about business issues. Um, Maybe if we could maybe cover a little bit about your, I guess the ROI on ultrasound, the fact that it's very usable, it's used all the time.
So the return on investment on ultrasound.
Yeah, that's right.
Okay, sure. So I guess for something to return on investment, it needs to have value, and then you have to figure out the costs associated with it. So it's not the cheapest thing. The cheapest thing is that you don't treat a patient and then they drop dead. So that's the most efficient financially. But assuming that patients getting better has value to you, then what you want to do is find things that actually give you additional value. And so one of the things that provides value is diagnostic accuracy. And so one of the things we want to figure out is what is the most effective way to get additional diagnostic accuracy. So if you're working with somebody, sorry, my hand's getting in the way.
Oh, it's okay.
Okay.
I'd say probably.
Keep
try
the
to
hands.
them quiet, yeah.
Okay. So if you are trying to get better diagnostic accuracy, part of what you want to know is where the symptom's actually coming from, which we talk about as finding the peripheral anatomical pain generator. And a lot of times you're dealing with areas where the pain generators can be right near each other. So let's say you're dealing with the shoulder within this space that's about the size of maybe a quarter or a half dollar. You have the biceps tendon, the leading edge of the supraspinatus tendon, you have the AC joint, you have the coracoacromial ligament, you have the subscapularis tendon. They're all right near each other, and patients can't really necessarily localize exactly where they're coming from. So it'd be really nice to have something that you can quickly, efficiently, effectively be able to distinguish between these different pain sources. So with an ultrasound machine, I can just call my medical assistant, have the machine brought in the room, and in under 15 minutes have a pretty clear localization of where things are coming from. And so the conversation from that point forward is, what do I do with this specific treatment? I think prior to ultrasound, we were using a lot of generic terms like mechanical shoulder pain, or we could have precision, but it would be false precision. You might say it's a subacromial impingement without actually measuring whether it was impinged and if it was impinged actually at the subacromial space. So just the precision just goes way up. And so I think that now the cost of that visit is higher because we're billing for a visit plus a procedure of doing the diagnostic ultrasound, but the yield of that visit is much higher, and it may be the case that that saves the patient multiple trips. It may be the case that if I'm referring that person to physical therapy, those initial physical therapy sessions are more effective because we're giving more precision. So I think the yield of that visit is much higher. It's definitely more satisfying. It's more satisfying to me because I'm able to be a little bit more precise about what's going on. I think it's more satisfying for the patient because they have better clarity about what's going on. I think it helps the patients be more engaged in their own treatment because they realize I'm not just making stuff up. I think it helps for my colleagues that I'm working with because they know I'm not making stuff up. So I guess it really just comes down to precision.
Okay. Can you give me maybe a couple of examples of use cases where, without the use of really precise ultrasound, where the visualization is really good and you're able to definitively say what's going on there and do a diagnosis? Some examples where if you didn't have that ultrasound, that you'd be really kind of hamstrung in your
Sure.
ability to get
Sure.
at it. Or maybe the alternative would be to send them to MR or something.
Sure. Yeah, I'm not a huge fan of the argument of ultrasound versus MR because I think they both have value. So to me, I know it's an argument that sometimes the companies make is like, hey, use ultrasound instead of MR. I think they're very complementary to one another. But in terms of situations where ultrasound just makes the yield of the visit just so much higher, a really common one is an injury called tennis leg. So tennis leg is most commonly an injury at the myotendinous junction of the medial gastrocnemius, which is basically in the mid part of the calf on the inside. And the patient, basically is playing a sport like tennis where they have a rapid contraction of their calf muscle, feel some pain, sometimes feel a pop, and then they have this intense calf pain. One of the things that's really important for me to know is there a pooling of blood in the area of the injury? Because if there is, and I drain that right away, it is something where that recovery can be super duper fast. If, on the other hand, we let that injury linger and you don't assess it right away, that blood can start to coagulate, start to form scar tissue. And then you have a treatment protocol or program that may be weeks to months. So if I am somebody who has a immediate calf strain, knowing whether or not there's a hematoma formation in that area and whether you can drain it while it's still liquid and it's not coagulated, that is a huge difference maker. Now that we can do that, this thing is frankly negligent not to. And so that's the kind of injury where it can just be a real big difference maker. Other times it's, you have somebody who has, just in general, pain's not a great indicator of how bad an injury is. So, with a lot of injuries, they hurt like the dickens when they happen, and then 3 days later they're better. And there's others that hurt like the dickens when you have them, and then they are continuing to be an issue. Or there's other injuries that actually don't hurt that much at all, and but they're unstable and they may need to be more surgically managed. So examples of this where it comes up is you have somebody with acute shoulder pain, they have trouble abducting their arm past 90 degrees, and you don't know, is it an acute bursitis versus is it a complete rotator cuff tear? It hurts, the patient's not moving the shoulder, you don't know if the limitation's from pain limitation or not. Just being able to pull in the ultrasound machine and look at the supraspinatus tendon, that is a game changer. Other situations, you have somebody who is a skier and they fall awkwardly and now their knee feels unstable. You can, under ultrasound in real time, you can very easily see the medial collateral ligament. You see the medial collateral ligament much better on ultrasound than you do on MRI, and you can do dynamic valgus testing. You can also look at the medial meniscus well. When you see a medial meniscus tear in ultrasound, it's actually better than MRI. There are some that you can miss if you don't have the MRI available. And then there are, similarly, you can look at the ACL. MRI is still better than ultrasound for looking at the ACL, but if you see a tear on the ACL on ultrasound, it's very meaningful. So where that can really be helpful is just in terms of gauging in someone who has a traumatic knee injury like that, whether or not you need to go to the MRI as a next step. So that can be really helpful. Whereas there's other times it's just very clear they had a grade 1 femoral side deep band MCL tear, which is a painful injury, but those injuries tend to get better fairly quickly. So it really can help give the patient some immediate prognostic information about what the next step's going to be.
How is ultrasound actually speeding your practice? Is it the ability, the portable nature of it, the fact that it's kind of an easy setup and so forth? Is it creating efficiencies in the clinic?
Is it creating efficiencies? I guess it depends on how you look at efficiency. I mean, it doesn't make that immediate visit faster because you're doing something extra. I think where the efficiency gains of ultrasound come are in the total number of visits you're doing. So I think in a traditional paradigm of musculoskeletal care from 20 years ago, somebody comes in, you have them tell you their story, you make a rough guess, you would maybe have them go to physical therapy with an imprecise diagnosis, maybe get an x-ray, they come back, they may or may not be getting better. Based on that, you may make some slight modifications, may have them do more PT, maybe get some other imaging, and it may be, for the patient, it might be an outlay of 3 or 4 clinical visits and then maybe 10 to 15 PT visits, and you're still sort of not knowing where you are. So with ultrasound, that first visit's usually longer because you're doing the same assessment you were doing before, but then you're also doing the ultrasound. I think where the efficiency gains and the speed of progress are is that you're going into that initial management faster, having a lot of information that may have taken 10 visits to get to. So the gains are you're assessing in one visit what might have taken you a total of 12 clinician visits before. So the The visit's not faster, but your yield per visit's way higher.
Is the patient sort of aware of that gain that they have, or they
No,
would
not
have to
not
be able
necessarily.
to compare it to something, right?
Not really. I mean, to be honest, patients tend to perceive different as worse even when it's better. So, yeah, so I don't know. I think where patients really appreciate ultrasound is retrospectively, where they realize that their recovery was faster than they had at prior visits with people who didn't use ultrasound. The other area where they get it is that when I use the ultrasound, I use it as a teaching tool. I'm pointing out things on the screen to the patient, and they're not going to know necessarily the technicalities of me describing the hyaline cartilage of the lateral femoral condyle, but they also know I'm not making stuff up when I say to them that I think that they have a patellar ligamentopathy because I am seeing thickening of the patellar ligament that is, 60% thicker than the more distal parts of the ligament. They don't know the terminology, but they can see what I'm saying. So, I'm pointing at a ligament area that's healthy, and then I'm showing the area that's not healthy, that's significantly thicker and has a coarseness to it. They can see the difference. So I think just having confidence that their physician is not just making stuff up, I think is helpful.
Yeah. Have you seen a significant increase or any kind of, leaps along the way in your experience, professional experience, using ultrasound in terms of image quality and capabilities?
Yeah, I think the ultrasound machines keep getting better. Our current machine is a Sonosite Export, which is a terrific machine. It has multiple advantages. One of the great things about it is it has essentially infinite focal zones, and what that means is that throughout the entire depth of the image, the quality is excellent. It would be similar to using a phone camera where both the foreground and the background are in excellent focus, and that's a technology that's not really in most cameras. And that's one of the main limitations of ultrasound machines in general is you can really focus in on an area, whereas on the Sonosite Export, the quality of the image is excellent both at the superficial view and the deep view. An example of where that's really super helpful, for example, would be looking at a knee, because often what I want to look at with a knee is to be a superficial structure like the quadriceps tendon, but I also want to be able to look at the cartilage of the thigh bone, the femur, at the same time. Historically, with older machines, you had to look at one or the other at the same time, whereas here you can see both at the same time with excellent quality. There's other aspects. I mean, the resolution gets better. So resolution would be defined as how close can 2 points be to one another and still see that they're distinct, which people perceive as crispness. The images are crisper. One of the things I'm seeing is on some of the older machines, they would have to do like a smoothing effect to try to compensate for the lack of image quality. Whereas on the newer machines like the Sonosite Export, the image quality is really excellent without having to artificially introduce any kind of smoothing. So it's a truer image. So the capacity for tissue differentiation is better. So all the parameters of the image are better, and I'm literally seeing things I wasn't seeing before.
Wow. Has that been, have you been able to expand the applications because of that? And if so, where?
So in terms of expanding applications, that's a good question. I mean, you're seeing things you weren't seeing before. And I think one of the things whenever you're looking at an image and you see something that looks different, you want to say, is that something real or is that an artifact of the way I'm using the machine? And I think what you gain with experience is you start saying some of those things are real things. One of the areas I think that's a really important one is the enthesis, which is where a tendon meets the bone. And you'll often see structural changes in tissue at those interfaces. And I think the newer machines make it so that you don't miss those things as much. And I think one of the things I've learned over time is entheses, they aren't always painful, but they're often a story that's being told about that person's past biomechanical patterns. I guess it would be similar to looking at like a fossil record or geologic formations where if you look at a geologic formation, that may not be an active issue now, but it's a hint of the history of that tissue. And the same thing is true when you're looking at different biologic tissues and you see structural changes that tells you about a pattern of loading that may previously existed. I guess it would be hyper specific. One of the ones I see a lot is in a part of the quadriceps tendon called the vastus lateralis. It's fairly common to see structural changes in the tendon that are non-tender, and that's often a sign that that person has a loading pattern where they're overusing their quadriceps. So I'm not actively treating the tendon. I'm not going to do a procedure there, but I can give that feedback to the rehab professionals I'm working with, like the physical therapist, and use that as a cue that they need to load their quadriceps less. That's really helpful because historically the physical therapy protocols were used the quadriceps more. So as it basically reversed the way we were recommending treatments based on something I'm seeing on the ultrasound equivalent of the fossil record.
I love the metaphor, the analogy. It's
Yeah,
really,
yeah.
really great. Are you a fan of geology and
My
and
PhD is in anatomy, so and a lot of people in my department were anthropologists who
Oh.
study the fossil record.
Oh, and very interesting. Yeah,
Yeah.
I was sort of getting that
Yeah.
idea. Oh, that's wonderful. Okay. Is there anything else that you would offer to your colleagues in the field who may or may not be at your level about the use of ultrasound and
Yeah.
the trajectory?
I mean, I think that there's lots of arguments you can make in terms of cost of care or quality of care, or return on investment. Ultimately, I like being the best at what I do, and and I don't know that I am, but I want to work toward that. And if you're going to be the best at what you do, you need to avail yourself of the tools of the trade that allow you to do that. And just like if my goal was to be the best doctor possible, I wouldn't volitionally take away my sense of touch or my sense of smell or my sense of hearing. You want to make yourself, you want to have access to all the tools of the trade to be able to sense what's going on. So we now have a tool that allows us with a high level of precision to visualize things that weren't visualized before. And so I don't know that using ultrasound guarantees you'll be the best. It's certainly only one person can be the best. But I don't see how you could be the best if you don't use the tools available to you.